Welcome to the University of Queensland Faculty of Health and Behavioural Sciences Alumni Webinar Series. My name is Paul Purcell, and today we'll be joined by Dr. Phil Choi from the Queensland Alliance for Environmental Health Sciences, or QAES for short. The team at QAES have been playing an instrumental role in the analysis of wastewater in our communities to detect everything from diet to drug use and, more recently, COVID-19. Dr. Choi is a postdoctoral research fellow with QAES and has been studying and working at UQ since 2013. I begin today by acknowledging the traditional owners and their custodianship of the various different lands on which we all meet today. On behalf of the university, I pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. For those of you joining us live today, you're encouraged to ask questions during the webinar via the Q&A function. We'll endeavour to address these prior to the conclusion. This webinar is also being recorded and will become accessible via the HaBS Alumni webpage, along with the other episodes in this series. And now, it gives me great pleasure to introduce Dr. Phil Choi.
Thanks, Paul, and thanks everyone for attending this webinar. We hope you learn a thing or two from it. So, have a look at this painting. Among other things that it communicates to us, it tells us about socioeconomic status, perhaps something about the lifestyles and the health of this young lady and this poor old beggar. And now have a look at this. This is wastewater. Today, I'm going to try and convince you that this wastewater can tell you just as much, if not more, about socioeconomics and lifestyle than the lovely painting here. Well, how is this done? We use a technique called wastewater-based epidemiology, or WBE for short. So when you, as many of you might know, your urine contains a lot of chemicals or biomarkers which reflect the things that you do, eat and drink. And when you go to the toilet, you're essentially flushing all this chemical information down into a sewer system. And that urine will combine with everyone else's urine, as well as industrial waste, residential waste, and so forth. And it all gets sent to a wastewater treatment plant. And by taking wastewater samples systematically at the inlet of the wastewater treatment plant, that is before it gets treated, we have what is essentially a pooled population urine sample. And by measuring chemicals in it, we can determine the mass of a chemical excreted by a community as a whole. And if we know the number of people that live or reside in these catchments, we can determine the mass of a chemical or a biomarker excreted per capita. So that's how wastewater-based epidemiology works. It's essentially a form of population urine testing, if you want to dumb it down like that. Well, what's wastewater-based epidemiology good for? Let's say you want to ask some people about how much methamphetamine they took on New Year's Day. Now, it's a potentially sensitive question, and you probably won't get a straight, honest answer. But you can get an idea using wastewater-based epidemiology. So here, for example, this figure is produced by some of our colleagues, and they've shown how drug consumption changes in a Southeast Queensland catchment or community from one point in the year to another. And they've taken wastewater samples every day to tell us what consumption of methamphetamine is like in this case across the different days of the year. And you can see, for example, that on New Year's Day and New Year's Eve, people got smashed on methamphetamine. Consumption also tends to peak during public holidays or special events, such as I think it's Labor Day here in May. And consumption is obviously lower in the weekdays compared to the weekends. Weekends are in red, weekdays are in blue. Wastewater can tell us some objective patterns about drug consumption or other chemical consumption within the community as a whole. And as you can imagine, the kind of insights that you can get with wastewater is quite useful for understanding the impact of drugs, for example, in our communities. For example, our group runs what's called the National Wastewater Drug Monitoring Program. It's a report that's released 3 times a year. And in each of these reports, we cover more than half of the Australian population by sampling the wastewater and report on a number of drugs such as alcohol, tobacco, cocaine, methamphetamine, and several other illegal drugs. The actual analysis is done 6 times a year for many different communities in Australia. And some of the results that you can get are summarized here for cocaine consumption, for example. You can see that consumption tends to vary between different states, so not so much in WA, much more in New South Wales. And if you go into the nitty-gritty of the data, you'll also find that consumption is different within the states and within capital cities or regional cities and towns and so forth. And so this had us thinking, could differences in drug consumption be related to socioeconomics? And this was a question that we wanted to ask in the project that I'm about to present to you now. So to try to answer this question, we set up an experiment. We collected wastewater from different sites in Australia, in total covering about 22% of the national population. And we took wastewater samples at the time of the 2016 Australian census, and that will become important later on. In addition to samples, we also took catchment maps. So maps of showing which areas were serviced by these wastewater treatment plant catchments. And we can take these catchment maps, go to the and extract data collected during that 2016 Australian census. And we can find information such as the number of people residing in each of these wastewater treatment plant catchments, but also other information such as the age of the people living in the catchments, their socioeconomic status, which is called IRSAD, as well as other socioeconomic descriptors of your occupation, education, household income, and much more. And on the wastewater side, we also measured different chemicals in the wastewater using mass spectrometry. We measured mostly pharmaceuticals, some illicit drugs, as well as biomarkers which tell us about people's diets. And then having this chemical information and this census information, we tried to combine the two to see what sort of relationships exist between biomarker loads, that is chemical consumption patterns, and socioeconomics. So I'm going to try to present some of the data in this figure. On the x-axis, we have correlations positively with age, negatives with age, as well as correlations with socioeconomic status. High correlation, high positive correlation, and negative correlation, and so forth. And we can start to plot the different biomarkers that we measured from the different catchments. And we can see, for example, that tramadol, which is an opioid, or desvenlafaxine, which is an antidepressant, things like these were significantly negatively correlated with socioeconomic status, indicating that you're more likely to see these opioids or antidepressants in areas with lower socioeconomic status. Things like hydrochlorothiazide, which is used for heart conditions, or morphine, an opioid and analgesic, these were positively correlated with age, indicating that catchments with older people were more likely to have more of these. Interestingly, things such as nicotine, hydroxycotine, or cotinine, which are tobacco consumption markers, were not significantly associated with either age or socioeconomic status, although you can see that it tends to lean towards the slightly lower socioeconomic status catchments. We also measured, as I mentioned before, biomarkers of diet. So enterodiol and enterolactone are indicators of dietary fiber consumption. And we also have biomarkers of vitamin consumption, citrus consumption, and caffeine. And these all were significantly correlated with higher socioeconomic status, indicating that perhaps people who are better off are consuming a better quality of diet. They're also consuming more caffeine. And interestingly, they also tend to consume more alcohol than the other socioeconomic groups. But that's not all. We can go into even more detail using the census data. So here, for example, I'm going to try to explain, if you just focused on the dots and lines that are in black, what this graph is trying to tell you is that if you have, for fiber consumption, fiber consumption tends to be on the lower end of the scale when you have more people in your catchment who haven't finished year 12 or higher. And as you have more people in your catchment who have finished year 12 or higher, your fiber consumption tends to be on the higher side. Conversely, in blue, you can see that if you have fewer managers in your catchment, you also tend to have lower fiber consumption biomarkers. So this suggests that perhaps fiber consumption or diet quality is associated with occupation and education. And we hope that perhaps this could advise people who want to set up interventions, for example, to better the quality of diet in communities. Maybe a good place to start is to address education in the different communities. We can do this sort of analysis for different biomarkers such as tramadol and opioid. Tramadol levels were lowest in populations where you had more high-skilled employees and where you had fewer laborers. Pregabalin, which is an antipsychotic, was lowest in places where you had more people having high household income and fewer people with disabilities under the age of 70. For a number of biomarkers, such as trimethoprim, which is an antibiotic, we didn't see any significant associations with socioeconomics, suggesting that perhaps their use isn't quite easily defined along socioeconomic lines. And like I said, we can keep going and on. So for example, ethyl sulfate is an interesting one. That's an alcohol consumption biomarker. And we see that alcohol consumption tends to be highest in places where the rent is higher. What's something else? Amitriptyline, that's an antidepressant, and its loads tend to be higher when you have more people in the catchment that haven't finished year 12 and so forth. Now, these are all really interesting findings, and you could spend hours going into them. But what we were interested in is the strength of some of these correlations were quite strong, and we started to think these relationships are quite strong. Can we actually start using these relationships as a basis for a model which predicts population socioeconomics? So we developed this model where basically we can measure chemicals in the wastewater of a population. We feed it into the model, and the model will try to predict various socioeconomic properties of the population that these chemical measurements are from. So I'm going to try to show you some of the results from that prediction. So here on the x-axis, we have various socioeconomic metrics such as median age, educational metrics, and so forth. And on the y-axis here, we're trying to show you how good our model was at predicting the aspects of socioeconomics. So the closer to 100%, the better it was at predicting closer to the census value, which we take to be the gold standard. So for median age, we see that our model's reasonably quite good at predicting the median age of a catchment given its wastewater. For socioeconomic status, not quite as good, but it still tends to fall very close to 100%. It was also generally quite good at predicting things related to education, such as whether you have a certificate, a degree, a diploma, whether you finished high school, and so forth. We can also try to predict things related to occupation. So generally, we saw quite good results for different occupational classes, such as laborers, the percentage of the population being managers, professionals, low-skilled occupation, high-skilled occupation, the percentage unemployed, and so forth. We can also try to predict household income. So income low means having household income in the bottom 20% of the Australian income distribution. And our model was pretty good at predicting low income, but not so much for high income. And we think that this is because at the end of the day, what we're measuring in wastewater is chemical consumption patterns. And we think that when you have a higher income, you're more likely to have a diverse or divergent chemical consumption patterns than you would have if you had lower income, for example. Our model also did an okay job of measuring things related to the social aspects of people and populations. So it was actually quite good at predicting the percentage of the population that was separated or divorced. Not so much for child and jobless, having a child while being jobless, but it did a reasonably good job, we think. It wasn't so good at predicting things related to housing, such as whether you have lots of bedrooms or few bedrooms in your house, whether you have lots of cars, whether you have a high mortgage and so forth. And we think that generally this is because, again, your housing characteristics are going to be perhaps some orders of, perhaps somewhat removed from your chemical consumption patterns. So that's why we think our model doesn't do such a good job of predicting things like housing, whereas it does a better job of predicting things like education, because we know for a fact that your education has a bearing on your life expectancy, your diet choices, and so forth. So what I want to really communicate is that wastewater analysis, or analyzing wastewater, can allow us to predict population socioeconomics. And that has important implications for a number of fields. For example, because socioeconomics is so intricately linked with consumption patterns, and because we can measure that in wastewater, we can use wastewater to understand population socioeconomics, but also potentially we could use it as a complementary survey method, such as mini censuses in between censuses. And this type of wastewater surveying would be much less expensive compared to traditional censuses or surveys. They'll be much more objective because you don't have to worry about people filling in biased answers, for example. And it's so it's much more objective, and also it's much faster to do compared to some of the other surveys. So that's kind of the take-home messages. Wastewater can tell us a lot about our socioeconomics. And lastly, before I finish, I want to mention something about why the seminar had to be postponed. And that has to do with another thing that wastewater is good for. So wastewater can also tell us about COVID-19. So when you have COVID-19, there's a good chance that you'll be shedding the viral RNA in your feces, and you can measure that in wastewater. And this map here just summarizes all the different places where scientists have used wastewater to measure COVID-19 in the communities. And for a lot of these places, they have ongoing government-backed programs to constantly surveil the wastewater of communities for the presence or absence of COVID. So yeah, when you have COVID, you can shed it in your feces, and by doing surveillance, we can get an objective idea of the extent of the COVID in the community. And as I mentioned, a number of places have taken this on board. So in Spain, France, and also in the Netherlands, the US, and so forth, wastewater monitoring is becoming an increasingly useful tool in assessing the extent of coronavirus in our communities. And our group at Quays at UQ is quite involved in this work as well. So we're running a program here at Queensland as well. And that's why, we were quite overwhelmed with this work lately. So that's why the seminar was postponed. But do keep an eye out in the space, because I expect that in the coming few weeks, there will be some news about how we've been using wastewater to track COVID-19 in our community. And that brings us to the end of my presentation. So if you have any questions, feel free to type them in the chat and we'll get to you. Thank you.
Thank you very much, Phil. That was fascinating. It was really interesting, particularly to see the correlation and the work you're doing in a typical COVID environment, which is very topical at the moment. We have had a couple of questions come through, so if I can, if you don't mind hanging around and just answering a few of those. The first one comes saying, can your model be used to predict socioeconomics in countries other than Australia?
That's a very good question. The short answer is no, and it all has to do with how consumption patterns differ between different countries. So our model is based on, for example, the fact or the phenomena of, for example, alcohol consumption being higher amongst more socioeconomically advantaged groups, or fiber consumption being higher amongst, again, socioeconomically advantaged groups. If you try to apply this in somewhere like the US or the UK, I expect you'd have roughly similar results because our consumption patterns are pretty similar with both similar kind of societies with similar cultural practices, roughly overall. But if you try to take it to, I don't know, India or China, I expect that the model would fall apart. Also because, for example, they might not consume as much caffeine for whatever reason, or they might have different pharmaceuticals available. So the same one that we measure wouldn't be detectable in wastewater and so forth.
Great, thank you. I've got another question here saying, how localized is the data? For example, is it by suburb or is it by city?
So I presume this is in relation to the census data. So when the Australian Bureau of Statistics collects the census, they record the results in different units, and these units can have different sizes. And the smallest size of these units are what's called mesh blocks. And mesh blocks tend to have on average about 200 or 250 people, give or take. And when we built our model and when we did these sorts of correlation analyses, most of our data was taken at a mesh block level or the one above it, which is called, I think, SA1. And that has a resolution of about 400 people, or 400 to 800, roughly. And the typical catchment that we worked with had populations at least in the tens of thousands, so they would have had 50, 100 or much more of these different census units.
Great, thank you. We've got another one touching on the COVID side of things, and it's asked, with the work that you've recently doing, how long does it take for you to identify COVID within the community?
It depends on how quickly you can get a wastewater sample to a laboratory. I guess don't quote me on this, but the latest number I've heard was 8 hours. But it's not like you can just go to a treatment plant, grab a bucket of wastewater and get the results in 8 hours. You have to set up your sampling. And once you have your sample taken, generally we would say 48 hours, assuming that sampling time is negligible, yes.
And another COVID-related question: has any of the testing being done had success in finding a COVID case where it hadn't previously been identified through traditional testing?
That's a very good question. So once the COVID pandemic started, people in other parts of the world started testing wastewater that they had saved before the COVID pandemic hit. And I believe somewhere in Europe, Spain or rather, some researchers there supposedly said that they could find COVID in the wastewater dating back to November. And as you might expect, some scientists disagree or question the study. But I don't think it's the first instance in which wastewater has been used to show that pandemics have arrived in places well before the public or the government knew about them. So another study, for example, measuring some relatively obscure Japanese virus that originated in Japan. There was a Dutch study in the 90s, I think, showing that the Japanese virus had arrived in the Netherlands a few years before the first, the first officially diagnosed case clinically diagnosed case in the Netherlands. So, yeah, it depends. If you have the samples in them, we can try to look for when the virus was present. Sorry, I think I forgot the initial question.
So, sorry, the initial question was, I think you've done a fairly good job of answering it. They were trying to determine, and based on the way it's been written, as to whether you can find, or whether there has been examples of finding COVID in places where traditional testing hadn't already found it. And it actually follows definitely in quite similarly to another question, which touches a little bit on your first question as well. So there might be a bit of overlap. But the question says, in some of the countries where testing for COVID isn't quite as stringent as others, do you think this would be a more cost-effective way of determining whether it's within their communities?
Definitely. We think that wastewater surveillance for COVID would be quite effective in places where you don't have the infrastructure set up to set up testing clinics and so forth, because you're effectively testing the entire population in one go. Of course, you can't pinpoint, which individual has it or where exactly they live, but it can be very useful to give you at least a yes/no answer or a semi-qualitative answer as to the extent of COVID in communities. One thing that you have to bear in mind, perhaps a small detail compared to the big picture, is that in really rural areas, in order to take a good wastewater sample for COVID, you need some equipment and a bit of manpower. Compared to clinical testing, it's nothing really, but in really rural areas or third world countries, for example, I would imagine that a lot of these wastewater treatment facilities or infrastructure wouldn't have the proper equipment required to conduct best of practice COVID testing. But it's something that's, I think, is reasonably easy to fix compared to, building a clinic and pouring nurses and doctors into it.
Great. It makes a lot of sense, and it'll be interesting to see how it develops, this testing in other countries. We've got one last question. It's going away from COVID, and it says, you mentioned the way that you can measure drug usage and things like alcohol. Can you measure things like fast food consumption and things like diet?
Yes, so that was the subject of my PhD, to try to measure aspects of diet. Things like fast food, we can't, simply because a lot of different foods have very common chemical components. And when you consume, a hamburger, you would excrete very similar things as to when you consume, I don't know, a roast turkey with vegetables, for example. So it's very hard to differentiate based on what's in your urine, exactly what you've consumed. So basically the short answer is it's very difficult. You can measure citrus, vitamin B, and fiber consumption. And there have been efforts to measure meat consumption and fish consumption. However, these have turned out rather inconclusive. And that has a lot to do with, for example, the stability of these chemical biomarkers in the wastewater. The meat consumption biomarkers, for example, aren't very stable, so we can't get a reliable readout, basically.
Bill, it's been absolutely fascinating listening to your insights. I know I've learned a lot, and it's really interesting to see how this will continue to develop. So thank you once again for taking your time to explain some of your work and the work that's done at Quays. It's been really fascinating. So at that point, we don't have any further questions, but I'd just like to thank you once again, and thank you for joining in. For those of you who have joined online today, or if you have colleagues who would be interested in seeing this, we'll upload this webinar after after this episode is complete, and it will be available at a link sent to you in an email. Thank you once again, and I hope you have a great day.